46 million Americans are without health care. Over 500,000 Kentuckians are uninsured. 8 out of 10 are from working families who don't receive health insurance with their jobs and can't afford to get it on their own. A doctor in Morehead, Kentucky decided to do something about it. Dr. Morehead had already founded an international organization to provide medical care in his home country of Ethiopia. After being in Morehead a short time, he quickly realized there were many people in his new American hometown who were in desperate need of health care. "We need a free clinic," he told friends. So he put together people with different talents and skills and held meetings intent on making his free clinic a reality.
There are so many people who don't have the financial capacity to have an insurance for their kids or for themselves. So to do such a community work within our community and reach out to the needy is, I think, very important.
The caring and persuasive Dr. Morehead formed a board made up of people he knew would take action and get the job done. They spread out into the community seeking other skills, talents, and donations. In August of 2005, the new free clinic, named People's Clinic, opened its doors. The founder of a successful cardiac rehabilitation program, Sarah Jane Howard, became the first manager, an in-kind gift from St. Clair Regional Medical Center to the people of the region.
18 years old and below, they can get help through K-CHIP, and at 65 and above, they will have Medicare. So we're trying to help the people that fall into that place to where they're working and can't afford health care, and so we can provide that.
Here's an opportunity to provide a service that is needed where you don't worry about finances.
I was surprised when I got here, to be honest, to see so many sick people, 30 years of age, and with so many diseases, arthritis, heart disease. It's just heartbreaking. I've never seen such a thing in my life.
When I first came to Kentucky, I couldn't get work, and I've been on welfare, and I've tried to get in with my children to see doctors, and a lot of doctors will not take welfare patients. And so I've been there.
A lot of people in the surrounding areas just don't have health insurance of any kind, and they rather than go without. They need some place to go, and this is a good place.
There's no way of tracking how many lives have been saved, but it's safe to say that lives have been saved, and many more have definitely been changed for the better. The faith-based clinic has renewed the faith of many that people do care about each other.
Hard to do things overhead, sometimes just brushing teeth. I just get tired. Or trying to fix my legs, they're kind of, I notice it in my legs too, but it's worse in my arms and it's in my face.
What problem do you have?
Diabetic.
Diabetic?
Yeah. I have trouble getting my sugar down. Took me for 11 x-rays last month, so I'm supposed to find out the results today. Because my back hurts all the time.
This patient is 35 years old, and he's going to be dead before 50. He's not going to live a long life at all because he's been a diabetic for so long and not knowing it and not treating. He's already damaged. He's already had damage to some vital organs, and that's sad. You see that all the time.
The clinic is a win-win situation for everyone. It helps hospitals and doctors burdened with a patient load of non-paying patients. It helps those who are insured by cutting the cost of medical care. It helps insurance companies, the government, taxpayers, and most of all, it helps our fellow humans lead a healthier, happier life.